Hi, I chose nursing trend number one, need to be technology savvy for my nursing trend for this week's discussion. I chose this because personally I'm not the most technology savvy, and so I've found that difficult, and I've tried to push myself to get better, and I did start out my nursing career as an LPN working at a hospital that used paper charting, and I was there for 5.5 years. So making the switch to an electronic health record was difficult for me. So I wanted to learn more because that's definitely the way that our world is going towards more technological advancements, and overall, I believe it's a good thing, but there are also some obstacles. So, this trend is improving patient care and wellness in many different ways. We have the online charting systems, automated IV pumps, portable monitors, wearable devices, smart beds, telehealth, and I feel like it makes it more accessible and convenient for patients to get health care, and the more created more options. And it's also, with as far as scanning your meds and everything, I think decreased the human error aspect of our profession. As far as some obstacles in adopting this trend, change is always hard. So when new technology comes out, there are always obstacles with first implementing it. Um, kind of get past that painful first part, and then the long-term effects are overall positive. Also, obstacles for our patients would be, you know, it's both a positive that it increases access for some, but it's also an obstacle for others, because I did do my health equity discussion regarding, broadband internet access, and I was really blown away by how many people in our country don't have access. So that is a hindrance and an obstacle for some. Another obstacle is, the communication. I know that nurses are being told to use the provided flow sheets that are included in the electronic health record, um, and to free text less often. And so this is frustrating for a lot of nurses because they feel like they can't communicate the procedures or the patient's current state as well as they would like to. Another obstacle is also for the facilities for data storage, because they have to keep this information current or safe, and has to have to store it somewhere. Um, Necessary teaching components. Oh, also obstacles would obviously be age related. Our geriatric population who are reluctant or even adamantly against technology, that would also be an obstacle with our technological advancements. Necessary teaching components. When discussing things with your coworkers, I would say be positive and try to not be reluctant to any of these changes, but to be willing to learn and understand or invest in the benefits that can be caused, and really learn all you can about whatever it is, especially if it's something that our patients are going to have to utilize themselves, as far as, patients accessing their lab results from home, stuff like that. The nurse needs to be able to educate the patient on those things and have a strong, firm understanding themselves. As far as discussing this trend with our patients, I think it's important to know and explain the benefits of what we're trying to get them to do with technology, and then really assess and ensure that they have an understanding of what's expected of them. And how do you know your teaching is and was effective? I'm a strong believer in the repeat back method. So, educating the patient and then having them repeat back what you said in their own words. I think this helps us to identify any miscommunication or need for re-education, and is the best way to assess their understanding of the education. Other content that I'd like to share is one of the sites that I used to research this was saying that a lot of people are worried that technology is going to replace the human interaction aspect, and that it was just explaining that in the nursing profession, human interaction and directly interacting with patients is such a huge component that that's not going to be an issue. You can't replace the human interaction component of our jobs. It is meant to help us help our patients. It is not to replace us. Our patients are still going to need reassurance. They're still going to need education. They're still going to need physical procedures. They're still going to need physical assistance. This is just ways that the world is advancing to help us and help them. All right. Thank you guys for listening, and I hope you have a great day.